Diphtheria is a serious and potentially fatal infectious disease that once was a major cause of illness and death among children, but has now become rare in countries with advanced vaccination programs. The illness is characterized primarily by a sore throat, fever, and swollen lymph nodes in the neck, creating a characteristic bull neck appearance. However, the most distinct symptom is the formation of a thick, gray coating on the throat and tonsils, which can lead to breathing difficulties and swallowing problems. Treatment for diphtheria is urgent and typically involves the administration of an antitoxin to neutralize the effects of the diphtheria toxin, along with antibiotics to clear the bacterial infection. People who are unvaccinated, have an incomplete vaccination series, or live in an area where diphtheria is common are at greater risk for contracting the disease. Here's a closer look at the detailed aspects of diphtheria, highlighting how it spreads, prevention strategies, and the potential complications that emphasize the importance of timely treatment and vaccination. Symptoms and progression of diphtheria. Diphtheria is a serious bacterial infection affecting the mucous membranes of the throat and nose. Initially, symptoms mimic a common cold, with patients experiencing a sore throat, fever, and swollen glands. However, as the disease progresses, a telltale gray or white thick patch, known as a pseudomembrane, develops on the throat and tonsils, potentially obstructing airways and making breathing difficult. This pseudomembrane is a hallmark of the disease. Without prompt treatment, diphtheria can cause severe complications such as myocarditis, peripheral neuropathy, and even respiratory failure. It may progress rapidly, necessitating urgent medical intervention, including antitoxins and antibiotics to halt the toxin produced by the bacteria and curtail the infection. Vaccination remains critical for prevention. Diagnosis of diphtheria. Diphtheria diagnosis is a critical process that hinges on recognizing its characteristic symptom, a thick, gray membrane covering the throat and tonsils. This potentially life-threatening bacterial infection caused by Corynebacterium diphtheriae can be mistaken for a severe sore throat. Early diagnosis is paramount. Lab tests to detect the toxin and bacteria help confirm the presence of diphtheria. A throat culture, taken by swabbing the area where the membrane has formed, can provide definitive evidence. Rapid identification enables immediate treatment with diphtheria antitoxin and antibiotics, essential for preventing dangerous complications such as myocarditis or nerve damage and curbing its spread through effective quarantine measures. Cause and risk factor of diphtheria. Diphtheria is caused by the bacterium Corynebacterium diphtheria. Its impact ranges from mild illness to severe respiratory issues or even death. Transmission occurs through respiratory droplets from coughing or sneezing of an infected individual. Crucial risk factors include lack of immunization, crowded environments, and poor hygiene, which facilitate the spread of this pathogen. Travel to areas where diphtheria is endemic elevates the risk. Moreover, compromised immune systems or a history of inadequate vaccination further increase an individual's susceptibility. The diphtheria toxoid vaccine remains the most effective measure for prevention, significantly reducing the incidence of this treatable, yet potentially deadly disease. Treatment and management of diphtheria. The treatment and management of diphtheria, a potentially fatal bacterial infection, prioritize prompt administration of antitoxin and antibiotics. The antitoxin, which is not a routine vaccine, neutralizes the diphtheria toxin, while antibiotics, specifically penicillin or erythromycin, eradicate the Corynebacterium diphtheria bacteria responsible for the disease. To prevent the spread, isolation of the patient is essential until they are no longer infectious. Furthermore, healthcare providers recommend diphtheria vaccination as part of the DTaP, diphtheria, tetanus, and pertussis series for children and booster shots for adults, emphasizing the critical nature of prophylactic measures in public health strategy to control the disease. Close monitoring for complications such as myocarditis or respiratory obstruction is crucial for optimal patient outcomes.